Kidney problems often build quietly, long before a person feels truly sick. The kidneys filter waste, balance fluids, and help keep the whole body steady. When changes start in the renal cortex, calyces, renal pelvis, or ureter, the warning signs can be subtle. So as we move through the symptoms, think of this as an early check-in, not a diagnosis, and a reason to pay attention sooner. That is why chronic kidney disease can be easy to miss. Sarah may look fine, smile, and feel nothing yet, even with stage 3 disease. Scarred tissue, cyst formation, altered internal structure, and impaired nephrons can keep progressing underneath the surface. The goal is not to guess from one sign, but to notice when the body's quiet signals start adding up. Back pain can come from many everyday causes, but persistent discomfort should not be ignored. When someone reaches for pain relief and still feels that deep ache in the lower back or side, it is worth asking why. Kidney pain is often not dramatic at first. The key is not the bottle on the table. It is the pattern of pain, especially if it keeps returning or comes with other symptoms. When kidney function drops, the blood can begin to carry what the body should be clearing out. That buildup of urea, creatinine, beta, 2-microglobulin, and other toxins can affect energy, appetite, and overall well-being. A healthy kidney filters steadily. A damaged glomerulus cannot keep up. This is why early symptoms may feel so general, yet still point to a real problem. Pain that wakes someone at night deserves attention, especially when it keeps interrupting rest. Not every ache is kidney-related, but a new or stubborn pain pattern can be a clue that something is off. Poor sleep makes everything harder to handle, and ongoing discomfort can be a sign that the body is asking for evaluation, not just another night of waiting it out. Itching can seem like a skin issue, but kidney problems can also leave people with dry, irritated, hard to ignore skin symptoms. When the urge to scratch shows up along with other changes, it is worth thinking beyond lotions and creams. The message is simple. Unusual skin changes are information. They may not prove kidney disease, but they can be part of a bigger picture. Healthy muscles depend on calcium, potassium, and magnesium working in balance. If kidney function is struggling, those minerals can shift, and the result may be cramps, weakness, or twitching that feels hard to explain. This is one reason kidney issues can affect the whole body, not just the urinary system. What seems like a small electrolyte problem may actually be an important clue. Puffy, swollen eyes can be another early sign that fluid balance is changing. Edema does not always begin in the legs. Sometimes it shows up in the face first, where it is easiest to miss or dismiss. Compared with healthy eyes, the swelling stands out, and that difference matters. When the body is holding on to extra fluid, kidneys are one place to look. Sometimes the most important warning sign is not dramatic at all. It is the feeling that something is different, more tired, more puffy, more achy, or just not right. That is why quiet symptoms deserve a closer look. If several small changes start adding up, a healthcare professional can help sort out what is harmless, what is not, and what should be checked next. Fatigue, worry, and disrupted sleep can wear a person down long before a diagnosis is made. But symptoms like these are not something to self-diagnose and ignore. If swelling, pain, itching, or changes in how you feel keep showing up, bring them to a healthcare professional. Catching kidney problems early can make a real difference, and paying attention is the first step. Kidney problems do not always look like illness. Sometimes they show up in people who seem healthy and active, which is why small changes matter. If you've been noticing swelling, fatigue, or a different kind of ache, do not brush it off. Staying active is good for your health, but persistent symptoms deserve a conversation with a clinician. A swollen ankle can make something simple, like putting on a shoe, suddenly feel hard. That kind of puffiness may have many causes, but when it lingers, it can be a clue that your body is holding on to extra fluid. If swelling is new, one-sided, or paired with fatigue or shortness of breath, it is worth getting checked rather than waiting it out. Skin changes around the ankles can be easy to miss. Redness, darkening, itching, or marks that do not fade may happen when circulation or fluid balance is off. By themselves, they do not point to one cause, but they are part of the bigger pattern. When your feet or ankles look different for more than a day or two, bring it up at your next visit. The urinary system gives kidney symptoms a clear pathway. The kidneys filter waste, urine moves through the ureters, and the bladder stores it until it is released through the urethra. Inside each kidney, the renal cortex, renal medulla, and millions of nephrons do the work. When that filtering system is stressed, signs signs can appear elsewhere in the body, not just in the bathroom. Morning routines can be a good time to notice how you feel. A quick check-in is not about guessing a diagnosis. It is about noticing changes in your energy, your swelling, your appetite, or how often you need the bathroom. If something feels off more days than not, that is a signal to talk with a healthcare professional. Small clues are easier to address when you catch them early. Breathing difficulty is not a symptom to put off. When someone is crouching, gasping, or holding their chest, that is a sign to take seriously right away. Kidney problems can sometimes contribute to fluid buildup, but trouble breathing can also point to a more urgent medical issue. If breathing feels hard, call for immediate help or seek emergency care instead of waiting to see if it passes. Fatigue is one of the most common complaints people overlook because it can feel ordinary. But when tiredness keeps returning, especially with swelling, sleep changes, or reduced appetite, it may be part of a larger kidney problem. Rest helps, but it does not explain persistent exhaustion. If you need more and more effort to get through the day, bring that pattern to a professional. Healthy kidneys depend on healthy blood flow. They filter waste from the blood, balance fluids, and help support red blood cell production. When kidney function drops, the effects can reach every system, which is why symptoms may seem scattered at first. A problem in the kidneys can show up as fatigue, swelling, or changes in urination long before anyone sees it directly. Swelling in the legs can come from different problems, and this infographic shows one of them, chronic venous insufficiency. When valves fail, blood refluxes and fluid accumulates in the tissue, creating leg edema. Kidney-related swelling works differently, but the lesson is the same. Persistent puffiness is a symptom, not a diagnosis. If your legs swell and stay that way, let a healthcare professional sort out the cause. By the time symptoms become obvious, kidney problems may already have been building quietly. That is why daily clues matter. Fatigue, swelling, skin changes, pain, or breathing trouble should be taken seriously when they persist. You do not have to self-diagnose. Just notice, track, and ask for help. A timely conversation with a healthcare professional can make the next step clearer and safer.